Alors, c'est la dernière table ronde.
So this is the very last round table for today. So yes, indeed, just before our minister will take the floor. And a little bit as a synthesis, we will not be looking at the different parts, but we will be looking at the quality at the level of a healthcare establishment. So it's not really at the level of the care or procedures, but the topic of how to evaluate or assess the quality of a healthcare facility. It basically goes to the same thing. So we have talked about prices, but probably we also have questions related to quality. We actually did the first step with IFAC here. We also had some problems and issues related to medical attractiveness for some countries and so on. But I also remember these campaigns, proud of my hospital, proud of my university hospital, because once again, all of these campaigns create some additional motivation for professionals to join a certain establishment. We can also talk about the environmental transition, and this is also a very important debate because we have talked about the relevance, but also the reduction of the volumes and the improvement of the environmental impact of healthcare establishments. So we basically see that all of it leads us to the question of quality. Throughout all the roundtables this morning, we have noticed that this is a very complex question. And in order to help move this reflection forward, I have together with me 5 key witnesses. Hello to all of you. So the advantage whenever we're talking about the quality of healthcare establishments in France, well, of course, it's very easy for us to start with Amélie because she is from the HAS, the French Health Authority. So you are here as a head of the department responsible for certifying healthcare establishments. So probably can you talk to us about the quality assessment in a healthcare establishment, just in a couple of words? So what is your vision of all of this? Well, first of all, thank you very much. Thank you very much for this invitation. I don't think that everything has been said. I believe that it's important for us to be here, to have this debate all together, and also to be all together just to work on all of these topics, because HAS, of course, works with all of the stakeholders, with scientific circles, as well as patients. And I think that it's really important for all of us. So with respect to my vision, I would like to give you 3 to 4 important messages, if that works for you. And that's quite fun, because today we have talked a lot about the quality assessment, quality in terms of relevance, not just quality for quality. And I believe that Marie Daudet has expressed it quite clearly this morning. So right now, we would like to probably talk about the quality of facilities, of establishments. And I would like to reopen it, rebroaden it with this first message that right now we would like to reconsider once again the certification of different establishments and look at it as a tool. Like at HAS, we are offering the tools, and one of them is the quality of the care. So why am I talking about this? Well, I would like just to give a small clarification or rectification with respect to what I have heard. When we have this certification, we're certifying a certain establishment, a certain facility, and this certification is not for services or other, just establishment, and this is for 4 years. The second important point is that this is not an audit. We're here to see what happens to give this result of the certification, and if it does not happen very well in the establishment, because for us it's important to learn how it happens, we have to also inform of that the ARS, and to see also how we can help this establishment if they have some difficulties. The certification is the managerial lever, and I would like to tell you this because the certification has changed a lot. We are much more working in the field. So this is also the tool of the change. It also is the tool that allows us to learn from the best practices, and it's something that favors the transversability. And it actually also registers the health establishment in this process of constant improvement of their quality. And finally, when we are questioning, because yes, indeed, we have looked at a lot of different evaluations, and the feeling after this evaluation, we actually have this feeling of accomplishment on behalf of the professionals themselves, a certain feeling of pride. I would say, yes, indeed, this is a hard task, but it actually gives us some pride as well. So that's an important tool, because this tool serves patients, but also professionals and decision makers. And indeed, here we can also see the commitment of the patient, the culture of the evaluation of the relevance, the teamwork, but also the advocacy adaptation to the evaluation of and assessment of the system. So we have talked about it the whole morning. That's my first message. The second message that I would like to transmit to all of you is that we are talking a lot about indicators. Everyone has mentioned indicators. Marie Daudet mentioned them this morning, and so on and so forth. Yes, indicators, we need them. We have to measure them. I think that this is part of the tool measures for an establishment, but we have also to ask, we have to ask ourselves why, what for. If today we are using an indicator to say, let's say, to look at the strategy in the hospital, to look at the organization within the hospital, to look at the occupation of the artificial intelligence and so on and so forth. So it's not the same thing as when we're talking about using an indicator in the financement to, let's say, compare establishments for the public diffusion and dissemination and so on. So that's not the same thing, which means that everyone has to take this ownership of different tools whenever it's possible. Please let me finish. So the third message that I would like to transmit to all of you, in the establishment, everything is measured by the quality of the professionals. So I believe that we have to start once again from the evaluation and assessment of the professionals, and we have this periodic certification that we need here. So we are offering the accreditation for the medics, for the specialists, and I think that this should be a must. And the last message that I would like to transmit to all of you is that it's very important to work with the patient, because truly the patient is the best ambassador. He or she is in the very core of the system for the certification. There is this whole chapter that is dedicated to them. They are also at the very center of all the indicators, because we are doing all of this inquiries and questionnaires of satisfaction to see whether this is something that corresponds to their experiences, to whether this is something that is satisfying. So the patient is an active factor and a partner, and that's very important. So yes, indeed, when we're talking about the indicators and all of this, I would like to go a little bit deeper into all of this, because I know that there are some chiefs of establishments that are discovering the values that are behind all of this. And I believe that this is something that is possible to integrate into their projects. So what would you like to probably get out of it? All of these voices of the patients that are coming out of it and that should somehow lead this discussion. So there are two important answers that I would like to provide to you here. We have talked about Kaliskop, and this is something that must be seen, yes, indeed, because it gives a lot of information about the establishments. And for some establishments, we actually use them. They actually use them as the levers for the improvement of quality. So now to go to ESATIS and talk to you about this, this is a national tool for all of the establishments. Well, we have 2,500 patients that are responding to all these questions of ESATIS every single day. So yes, indeed, we have some questions. We have to digitalize all of this and also use the artificial intelligence. We're already doing all of this, but these questions also have some comments. So ESATIS, this tool is also being used today for IFAC, and this is for the hospital entries for over 24 hours and so on. We also had some analysis between 2016 and 2020, and we were able to analyze 2.4 million of comments from Verbatim, this other tool, using the methods of the automatic treatment of the language. And the results, the outcomes of it are also very important, because what we see here is really the feedback from the patients. It means that we have this circuit of the care, which is very much coordinated. The quality of human relationship is another important outcome here. We have talked about all these qualities this morning: the professionalism, the quality of the information that has been transmitted, the quality of human contact, and the hospital quality that should be adopted, the quality of welcoming as well. Yes, indeed, what is very interesting is that what we can hear here is like a red line that we see all over here, is this continuous improvement. You're talking about this 4 years evaluation and how the establishments are using it and what they can do with all of this. So all of this, little by little, becomes the topic of everyday life. So now I would like to give the floor to Arnaud, because I know that this topic of the continuous improvement is especially interesting to you. You came 9 months ago to Nancy, and you have discovered this medical community and healthcare community with a highly effective culture of dialogue. And just before talking this quality, you have this real culture of training and information. Yes, indeed. Thank you very much for having said that. This is something that goes back to what you have already said. Of course, we understand that we have over 150 different jobs in the medical field, and we understand that all of this contributes to the quality of the care in the hospital. So for us, the main stake is how can we organize the management in order to gather all of the necessary conditions to provide the better care for the patients. So whenever we are talking about management, we start by measuring the quality of the process, meaning that we will have 3 to 5 different indicators for each process. So immediately we will start to have like 3,000, 5,000 different indicators. So in terms of dashboard, we are very quickly at the critical size of all of this. So it's quite complicated. And we also have to recognize that the quality of care is part of the preoccupations of the management of the hospitals, and this is in order to get the certification by HAS. But in addition to all of the processes, logistical processes and restaurant processes and so on and so forth, we have to recognize that all this governance is very important here. So when we're looking at this important governance and at these gaps that exist there, I think that there are 2 important elements that allow us to simplify this topic. Well, this is not revolutionary because, of course, we already know all of the solutions and all of these ways. So the very first is the management for the breakfast. So this is the culture of the company. The culture of establishment is much stronger than the managerial organization, which is very important. Of course, it's important to get it really into the system because it's not really material and it's not always everyone is not always aware of all of this. It's not very easy to define, to write, to understand in the functioning of each and everyone. And at the University Hospital in Nancy, I'm very, very attentive here. So with this absolutely incredible work that Bernard Dupont, my predecessor, has done in there, is basically the constitution of this incredible cultural capital, this dialogue between the doctors, the caregivers, the patients, and so on. So we have this absolutely extraordinary culture between medical and economical and social fields. So we have all of these actors that are here, and it's very much integrated. So we have this culture of the general interest, and this is a capital that is already here. So I'm very much attentive to how all of this works together with the goal of capitalizing on it and going even deeper. The second very important element here, well, I'm sorry, but these are the models of the continuous improvement because these models have already proven their efficiency in the industry. But we already know that there are many, many different models for continuous improvement. So for me, the topic is that we will produce it in Nancy, and it's important for us to integrate it. And then we also have a diagnosis, we also have therapeutics, and what we say and what we understand, all of us, is that right now we have to actually do it, not just say it. So what I would like to say is that it's not just talking about indicators whenever we are talking about continuous improvement, and not just with respect to the establishments that are very much data-driven, because I remember Sébastien Proto and everyone who did a lot of things there. That's very, very interesting. But for us, the University Hospital is a public establishment, so it's really part of the culture. And beyond all of that, whenever we were talking about the artificial intelligence, it is also part of the practice of medicine, but also of all the organizational aspects. Let's say if we would like to do some AI on the operating blocks, it's actually part of the machine learning. So we actually have to do this very good practice for the machine learning, and we have to have this process that will be very optimized and working very well. So this is how we go back to this topic of culture and continuous improvement and how everything is learned, because it's based on learning. So I actually remember that during your study field trip, you decided that there was a very interesting way of matching these methods of continuous improvement culture and the culture of healthcare community. So talk to us, please, about this study trip to Chambéry that you have done here. So can you please talk to us about this? Yeah, I would like to tell you this story, and this story is actually from Chambéry. right next to the Lake Bourget. And this story is the following. It shows how the stakes and the challenges, well, once we have the diagnosis and therapeutics and this ambition to develop a culture and a model of the continuous improvement of the University Hospital of Annecy that goes back to the culture and capitalizes on the culture and everything that we have. So how will we do the training here? How will we use everything here? Let's say logistics are already used here and they have already integrated this continuous improvement. Now with the care, it actually starts by the emergency, by the intensive care, and we also have to go to the continuous improvement here as well. So for this Chambéry history, it's also very extraordinary, and it's a good example because here we have the framework that became kind of a center, a pole, a hub, and we actually saw here, there was this one person who traveled and who saw that there were some points here that were not formed enough. So she traveled and she studied the question and she came back with all of this information, and she actually talked to the doctor who was working in the center of simulation, and he had this huge pedagogical culture. So the contact that happened between both of them was absolutely fantastic, and they started going through this topic and looking through all the details. And then there is this pedagogical approach. So what will happen, let's say, between e-learning, PPTs, and so on, so people can look at the PPTs on their own, they don't really need the follow-up. And what will need a pedagogical approach? What will need, let's say, lectures? So this will be like reduced means and so on. And what needs actually simulations because it will need some change of behaviors. So they have created this educational training that is given everywhere in that hub, and it actually works very well because it allows to get this very good assimilation of all the tools and of all this knowledge. And they're testing it a little bit broader for the second time. They do this second generation that works even better, but that is a little bit broader and wider. And they actually talk about the making this training mandatory for everyone. So it actually, what happened in December, they had this very first pioneer generation, and we will be doing the training for the second generation a little bit later on, in January, I think. So throughout the simulations, we have this engineering that is already here, and the model of continuous improvement is absolutely fascinating here. So that's really, really interesting because we see that this topic talks about system, but also about culture. So now I would like to give the floor to Charles, because Charles, you have this experience that actually is very fascinating, and we would like to look at different steps here, either at Gustave or at Nice, how the quality was appreciated here. And there are several key topics here whenever we're talking about healthcare establishments. Well, even though we have talked about it this morning, we would like to keep this topic as central because this is the quality of health care, and this is what is the most important for all the establishments and facilities. So the certification, the validation of the teams of healthcare professionals is something that is mandatory, and we cannot leave this topic aside. So what I also would like to say is that we have some expectations in terms of quality from our partners, but also requests and expectations of operational quality that describes processes and the audits, the interest of organizing all of these audits. And we also have the quality that has been felt. And the questions that have been asked on this roundtable about proximity and quality are also leading us to what is a good hospital, because from the point of view of the patient, a good hospital will be a hospital that considers the presence of the patient as something important. I have read your verbatim, but I will not really go into the detail of what I have read. And to feel really part, to feel really associated, informed at every single step of their presence in this establishment. And to see how around this expectation, this experience of the patient that will be like an ideal experience for us, how can we build and manage this very complex system that you have described in order to achieve this goal? So the goal where the experience is a very successful experience and all the gaps are not really the very center of the medical and economic mastering for us, and to address all the issues so that to grant the satisfaction of the patient. And I also am thinking here about the logistics and the flows of information, especially related to the patient. So how can we move forward with respect to all of this? And we can see them in the establishments like the Cancer Research Center in Gustav as well. Because these are the mono-topic-oriented organizations and sometimes small organizations. Well, this one was the small, but then we also have one in Nice and in Nancy that are much bigger. So there is this certain ease about these topics. And also look at all of this, because this is part of the DNA of this Cancer Research Center for years and years. So this is also what I have seen in some university hospitals that have some maturity with respect to these topics that are even probably more recent, but we have a lot of progress and acceleration on all these topics. Now, with the university hospital in Nice, the example, well, it's not really the opposite, but it's a very different example, I would say, because this university hospital has 8 sites, so that's really huge for some sites and a little bit smaller some others. So when we're talking about the Nice University Hospital, well, I will not tell you which one exactly because we have 3 of them there, but we have approximately 100 different services that have nothing to do with the specialty. Well, I'm not really teaching you something new here because this is how it happens at the university hospitals. And a very surprising phenomenon here is this will of the management and of the administration to actually have this culture of quality. And we have people that are trying to protect themselves within all of this in order to emerge. And we also have some institutes that are more well-known than those who founded them, and some of the hospitals in France have this case. So we have these institutes that are emerging here with their own system of quality and system of satisfaction. You have talked about ISATIS. It's not very easy. I would say Google works very well, and this is basically scary because if you start doing some research on your hospital, and some services for the university hospital were doing it, they were doing this surveillance online, so they were doing this little mini certification in real time starting from Google, so they would say, oh, there was this problem here, so we probably have to solve it. So there was this partnership between Google and university hospital. Well, pretty much. But we can see that there are some things that happen here because there is this will to achieve this excellency, to achieve this quality, and there is this will within one group or one organization to be more performant, to be better organized, to be better oriented in order to work on these questions and provide satisfaction to the patient so that the patient will come and come again, just as the intelligence that we have for the primary care consultants. So we have people who don't really have any opinion, who never came to the hospital in their life, so they don't really know what is the control that should be done, what is the assessment. So we have approximately 90% of these people who will be coming for the very first time, the very first consultation. Yeah, indeed. So from time to time, it's done just to have some patience. But during this announcement, for us, it's the moment to go back to the very serious things and to add a lot of values by doing the follow-up, because it's essential for us to do this very first consultation in order to create a treatment, to offer a treatment. So I can see here the very important cultural change. So this cultural phenomena is basically coming. But what is also interesting is to understand who we would like to express to what we're meaning in terms of quality. And also, whenever we were talking about this vision of the establishment, healthcare establishment with you, you talked about this personalized, individualized approach. This is the individualized approach that we can have every single day toward the patients. And that's what big hotels would like to do. The M, well, not really for Mont Blanc, but for MGallery is here. So for you, this individualized approach is at the very heart of your activities and of what you're trying to give your clients. So probably you can talk to us about your vision of hospitality and probably introduce yourselves as well. Yes, my name is Jean-Yves Laurette, just as it is said on the screen, and I am the director of MGallery in Geneva, starting from 1997. Yeah, so I work in Switzerland in Geneva, and I'm there here at the Hotel Rotary Group in Geneva, and I'm one of the collaborators for over 40 years, and I'm proud of being it. And hospitality, that's a very important word, but I would like to share with you some important moments of my professional career. Some 30 years before that, one of our managers wanted to organize a seminar for the administrators and managers, and he brought us to Ghana Gobi. I don't know whether someone here knows where is Ghana Gobi. Well, I actually looked at it, and it's in Provence. So he actually organized there a workshop, a seminar for the high management that were managed by the father Hugues Manguet, who was ex-professor and who actually did not want anymore to work as a professor, and he decided to pass his knowledge on to the higher management. So he welcomed us, and for him, in 2 words, hospitality is to welcome every man in the sense of humanity, and everything that is related to it whenever we are talking about health and hospitality. Yes, so for me, this is the definition of hospitality. This starts with our teams. I would say that in our hotel, when we are going to the hotel, it actually is to have some comfort, some peripheral services. This is what we call the hard service. But at the next to it, we also have what we call soft, and this is something that shows your image, that shows all the additional things, and this is something that moves forward and shows to the client everything that is necessary, and it actually allows you to individualize the service. So whenever you are recruiting your collaborators, what are the important things for you? Well, for me, there are 3 important points here when I'm recruiting, 3 aspects, and I'm always sharing all of this with all of them. So this is the situation. We have to be clear from the very beginning until the end, and everything must be said. So the first thing that I will ask them, will you accept to work while others are having fun? Because this is part of our job. So whenever everyone is having fun, we are working. So in the hospital, it will not be exactly the same expression, because others are not really having fun, but we also have some work, shifts and things like that. The second question, will you not do to others what you wouldn't want done to you? And the very last point for me, will you take pleasure in giving pleasure? Because for me, if we are in agreement on all these 3 important points, then we can continue working together. That's very important. So we were talking also about the success. So for me, in my role, I see myself as the chief of an orchestra in my hotel. And for me, it's a little bit like hairs. So what are hairs here? Well, all the important tools that I have here. And I have all the irritating elements that are here around me, like the coffee machine that does not work, or something like that does not work. But all the time, I must be empathic for our clients. So you were talking about all of the small gestures, all of the small attentions that are not very expensive to do, but this is something that allows you to really make a difference, to really show yourself as different, and to also take a special care of your clients. Can you please describe all of these little touches, little things, little shows of attention? Probably this can be very inspiring for us. So the very first point is what we have organized is the pillow menu. A pillow menu because we have 4 to 5 different pillows that we are offering that are of different shape and of different hardness and of different matter as well. So the client can select the pillow that they would like to have. So Charles, for us, the menu for the pillows, when are we going to have this? At the university hospital. So this is also a very small gesture, but very important. If we know that the client is passionate by golf, we will also give him a book on golf for his next stay, let's say, because we have this information and we know it. Well, for the 100th time when he comes, we will give him this small gift. So all of this is basically coming from the information that our collaborators provide us. Without these collaborators, we are nothing. So in order to succeed, everyone one has to take pleasure in giving pleasure. So this is really an individualized approach, and we can see it throughout the voices of the patients and also throughout all of the reflections. But also what is very interesting is that it comes from your teams. So all of these ideas, all of these proposals of little touches of attention, it comes from your staff and from your collaborators with your client always in the center, like the patient that will be in the very center. And now I would like to probably give the floor to one of the patients among so many millions. So you were the president of this association, Alliance du Cœur, and we have talked a lot about the quality of the healthcare establishment. But for you, just quickly, it's not just the healthcare establishment, but a much more global vision, the whole journey. So can you please describe to us your point of view related to the quality of the healthcare establishments and certification probably as well? So first of all, I would like to tell you that I have selected a hospital in Switzerland just because it's very, very good, and it actually gives us the sleepers as well as the ropes and so on. Well, what is very important is the certification. It actually is important for the patients, and also to know the identification of the establishment, the quality of all the care, whether this is correct and optimal for us. So for us, representing the users, that is very, very important. Of course, someone is participating in this certification. There are also representatives of the users there. So it allows us to get this information together, all of this. So when I go in the field and I also meet some other representatives of Alliance du Cœur, they will tell me when there are some problems, some issues, some establishments are not really compliant, are not really good, and some others that are very good. So I would say that for us, it's really very good to have the patient as part of this evaluation. Well, it has been for some years now. So you are here transmitting us the voice of the disease, of the patients. So we also have the vision of the chronic diseased and also the vision of different pathologies. So you have different points of view here. And the articulation of the collaboration with the city and the hospital is quite complicated, but you have this vision as well. So you in your vision, we cannot really stop at the walls of the hospital. So how can we deal here? Well, we are talking about the certification of an establishment. I have listened to you, and this is fantastic. And for some of you, it's absolutely fantastic when we are inside in the hospital. But whenever we leave the hospital, there is nothing else. So the hospital the system after the hospital walls is not very well organized. So what we would like to do in our association, and I believe that people around us would also like it, we would like for this certification to be a little bit different in terms of scheme, meaning that we will take into account the whole journey of the healthcare in this network. Because let's say for the chronic patient, well, for the cardiac patient or something like that, well, when they were in the hospital, they were cocooned, they were also happy. And when they're going out of the hospital, there is nothing else. And sometimes there will be 1 month of wait before they will see someone else who will advise them and probably give them some advice, probably give them some comfort and things like that. So that's a huge difference, because when they were in the hospital, someone was there to always tell them, you have to take this and that. So when this person is alone, it's absolutely terrible, which is why we have to do a lot of work here. So the question rises here, what should we do right after the healthcare establishment? So we have the certification, and it's absolutely fantastic. You are doing a lot at the level of your establishment. We have all of these results. But there is a gap right after. What happens after the patient leaves your hospital? Well, I actually would like to go back to your question, because I believe that this is very important. It is true that today certification has evolved a lot, and we are making it evolve a lot of times and very regularly. Right now we are at the 5th version, and every time we are introducing something new, because we always have this feedback that is coming from the field. We have the feedback from the experts that are visiting, because they're our peers and our ambassadors at the same time. And also we will modify the references. In 2023 we have already modified the references by including ethical criteria, and next year we are going to modify it to working on all the digital criteria. We have already talked a lot about it, especially with respect to the recruitment of the experts, visitors that are specialized in this particular questions. And we also have started the reflection for 2025, which is why I wanted to take the floor right now, because we have I would say, three important points, and this is all of this thinking surrounding the territorial aspect. We have talked a lot about it, meaning that certification, yeah, this is a hospital, these are the drugs and so on, but once we leave the hospital, all of this relationship between the city and the hospital is very important, so we are thinking about it. And the second point is that we have talked a lot about the link quality with all the resources, the management of the human resources, the delegation of tasks, the quality and the health of the professionals, the teamwork and so on. These are the ongoing discussions, and also the environmental transition. So just to tell you that we actually hear all of these questions, we understand them, and we will continue working on all of these topics. So if I could go back to all of this with respect to the certification, I believe that the University Hospital of Nancy has a lot of different establishments that are directed in common. It actually allows us to work on this journey of the patient that becomes very interesting. Well, I wouldn't say that we are the main example here, but at the level of the work is very important, because the HAS allows us, offers us this certification approach that is common to a lot of different establishments, like the university hospitals as well. And it actually allows us to see how it happens between the different establishments of the same type. And we also have this very violent side of the hospitalization and hospital care, because, well, of course, we have this announcement that is here, and the care is absolutely massive for the patient whenever they're coming to the hospital. And then after they leave the hospital, they're basically in the free fall. So that's the very first stone, I would like to say, that is put here, and that's very interesting. And of course, we are starting this approach of the HAS with a lot of interest, because it allows us to go even further in terms of improving the journey for the patient and giving them even more. We are also working a lot, and that's also an important interest of the territorial administration of Nancy, of the city. We're working with the city, with the social services, on managing this patient healthcare journey. A lot of things are done here in the interest of the patient, because this is part and the very core of our job. But we also have a very important mismatch with the financial models. So we have to work on this topic and get a certain alignment here, because we have this orientations and models that are the very heart of our job, I would say. Yeah, because when we're talking about the qualities, we also have this perspectives of the evolution of the financement model and price model as well. So at the level of FEHAP, but also at the level of the university hospitals, do you think that this is a real opportunity to probably get on this journey even more, and probably to associate all of these issues related to the management, associate it a little bit more to our community of professionals and higher management? Well, I would like to say a little bit more on the questions related to the territorial aspect, because with respect to what has been said on the during this CHAM, we understand that we have a lot of silos at the level of the hospital establishments, and we have the silos at the level of the university hospitals. So you're trying something that is medical and social, but we don't really have all of these bridges that are created among different establishments at these social and medical and health care establishments. Well, it's not really the best ally of the health care in here. So whenever we have all of these residents, like fragile people, we can probably keep them for a little bit longer before they will be getting out. And all of the crises are basically also related to a certain profile of the patients, probably elderly patients and so on and so forth, and they can overwhelm the hospitals. And we also have to make sure that there is an aftercare service that will be adopted and adaptable, that will allow the patients to become the patient X, but also the patient that still needs a follow-up, and to have all of these approaches. And what is really, really regrettable here is that we cannot really create all the links and bridges between these two different universes. Nothing is impossible, of course, but we have a very different logic that is here for the university hospitals, and the silos are very well limited. And we basically see that today this situation is quite difficult, because we can do the Article 51 and we can do a lot of things in this sense, but we still have a lot of emergency situations here in terms of collaboration, because the hospitals and their universe, even beyond all of the city doctors and things like that. Well, this is also a topic that is probably a little bit more in advance with all the efforts that right now are given to the coordination of the professionals at the level of the city. But I think that medical and social topic today is a crucial topic, and we can really dive into all of this. And we can also look at the dynamics of the payment for the short term, long term, and so on and so forth. That will strengthen all of this is relative, strengthen the financement of the quality, which is a very good thing for the motivation of the healthcare establishments. Oh, it actually reminds me of the project that you have talked to me about, this approach, territorial approach of cooperation, coalition, cardio-neurovascular disease coalition project. Can you please talk to us about this? Because here we are talking about the Loire-Atlantique region, next to Nantes. Yes, indeed, this is Loire-Atlantique, and right next to Nantes, and this is like the sector that we're working in here. So we have hospitals, we also have some healthcare professionals and patients that are here. We also have some institutions that are here, and we also have some other organizations. So altogether, we are thinking about this because it's important for us to gather all of these patients that can be taken care of optimally, but that are not in the system, unfortunately, because we have very few of them that were able to enter into the system, the maximum coverage system, and a lot of them are still on the way. So we are trying to think about how we can gather all these people and do the follow-up for all of them, and to avoid the situation when we will have very complicated situations for them, because here we're talking about the cardio-neurovascular diseases. Let's say if we have cardio problems, it can create very important issues, and the person can go to the hospital for that. So we cannot stop at the doors of the hospital. Whenever the person leaves the hospital, something must be here for them, a certain system, a certain journey that is somehow organized and delimited. And all the stakeholders, all the different actors must be here, meaning the cardiologist from the city and some other actors must all be here, the pharmacist as well, and the family doctor, and so on. So all this is a good scale, I would say, because we're talking about millions and millions of professionals. Yeah, for now, as I'm explaining, this is a project. So we are looking at all the implications to see whether this will be feasible. And of course, we are also directing all of this at the CPM to present it to them and to tell them, like, that's what we're doing. What do you think about that? So this is an evaluation right now. So we see here this populational approach as well. And it is once again put at the very center of the topic. Yes, indeed, we're talking about all of this, but the prevention is not something that we can say but not do. Yeah, I would like to step backwards and probably come back to you, Jean-Yves, on this question of welcoming and hospitality, because I remember the story that you have mentioned to me, because we're all facing at least one time or several times in our life experiences that will include hospitals. So you have basically lived through two different experiences, very different experiences, hospital experiences, through your close ones, through your loved ones, one in France and one in Switzerland. So these experiences were completely different. So it's very interesting, because here you are not really talking as a patient, but as someone who has just observed this situation from a side. Can you please talk to us about this? Yeah, well, this is something coming from life. So the first one is the experience of my wife. She actually went to see her gynecologist, and she needed a mammography, and she was welcomed in this little beautiful room, and she was given a robe to change her clothes, and then she went to see the doctor, did this mammography. So everything was very much respectful and very well organized. The intimacy of the person was very well respected, and I believe that all the ladies here will understand what I'm talking about. I think that this is also very, very strong, because it's not very easy for a woman to undergo this examination. And that's like a facilitating factor, I would say, because it makes this pain a little bit less difficult to bear. And the second experience is for my daughter, who broke her wrist in Annecy. And we were, well, in Annecy, in the hospital center of Annecy. So just to do the X-ray, the very first try to somehow put it all together, and the X-ray right after, and so they told us to stay and sleep there, and probably tomorrow morning we will look at it once again. So next morning at 9 o'clock we see that the person is no longer here. So at 10 o'clock all the surgery was over, and she saw the doctor at 5 o'clock, at 5 p.m. So she stayed for 17 hours, taking a bed for nothing, with a broken wrist. But 7 hours to wait for the doctor, with all the stress that is here, with all this anxiety and things like that. So these are the two experiences that are completely different. But what I also wanted to underline, this first experience in Switzerland, and I would like to underline Switzerland once again, is that when you have the appointment at 5:30, at 5:28 you will get into the doctor's office. Well, this is not exactly the same thing, I would say. And the question of delays for the appointment, but also for the care, this shouldn't be indicators that are part of the debates, and this shouldn't also be indicators that are very difficult to look at and to organize. These are part of organization, and this is completely associated to the quality, perceived quality. But you have also talked to us about this question related to comfort, because, I mean, this is an elephant in the middle of the room. Every time when we are talking about this, we can see it in the forms of SATs, the topic of comfort, of the welcoming. Oh, the patients are not very happy because they ate, the food was not good, but they're not here to eat, so it doesn't matter. So is it still a fatality today? Yet? Well, I have two prostheses at the knee. And I had my surgery in the hospital, ex-hospital Kennedy in Tours-aux-Mérins. So we have this menu that is given to us for us to choose the food. We also have the menu for wine. So just to tell you, this is what is being offered there. So what is preventing us from having the same thing? What is preventing us in public hospitals or para-public hospitals to have the approach that will be much more inspired on this patient experience? Well, probably not really adopting all of these very advanced models, but just to go a little bit toward the comfort, a little bit more toward the comfort, toward the food, toward the individualized approach, toward this hospitality. Do we have some hurdles today, some obstacles to do it? Well, of course, we have the financial dimension, yes, but I think that some of the small touches are not very expensive. Some of the small attentions are not very expensive, so it's not just the financial dimension. Yeah, we'll understand that when we have the economic model that is quite limiting, and a lot of hospitals, especially public hospitals, they actually are they are mentioning this topic because this is an important, challenging and questioning topic for the positioning. That's what we have been saying, and we see that all the establishments right now are working on the noise, the level of noise, and the schedule of meals, but also the experience, let's say, for the TV next to the bed of the patients, so that they won't have this very old-fashioned TV, but an HD TV. And this is a little something that inspires us or reminds us the hostel world and the hospitality, the hotel world and the hospitality world. And, well, very often this is not something very, very costly, and it actually, well, exists. Just to give you an example with Nice, because there was a Wi-Fi that was installed there, and you were thinking whether this was your role or not. Well, yeah, I think that all the hospitals know that we cannot call in the hospital because this is how it is in there. So we have organized 4G in there. So we were asking ourselves whether it was our role to play, whether the insurance, healthcare insurance, had to pay several thousand euros for the 4G. But we actually understood that a lot of people were using this 4G, and the major problem was the problem of communication for the patient with their family, because when they are in the hospital, they cannot really call, and it's very difficult to communicate with the family. And this was a lot of problem because it was creating a lot of tensions. And this is something that was reflected in the situation. So we started working on it, and we are right now starting to really try to fluidify the experience of the patients. Does it make you react? Well, I believe that we should probably also look at the paid services that are offered here, because the patient can also participate here. If I am hospitalized tomorrow and someone is offering me interesting services, I don't see why I wouldn't pay for them when I'm in the hospital. Well, I think that this is an additional service, but a lot of people would understand that perfectly. Some things like you're talking about Wi-Fi or additional TV or VOD or things like that. I think that the patient has to be aware of the fact that this is a service and the health insurance shouldn't pay for that. And the very last comment, yeah, you were talking about the well-being. Well, we have equipped all of our televisions with Chromecast. So the client can, from their TV, project whatever they would like, the videos of their family, Netflix, and whatever. So they basically keep this link with their own, this connection with their own network. And I think that all the hospitals can also have this Chromecast. So my question is, when are you going to become a hospital? Because we're losing a lot of time here. Yeah, and the very last reaction, probably with respect to this topic, I would like to say that this is a must-have, a nice wave topics. And after what Charles has said, well, this cultural turn, crossroads is right now being taken, and that's the question that starts at the governance, and this topic is basically being tackled. But we still have a lot of different modalities, as well as the artificial intelligence that introduced also a lot of different points. And at the level of the artificial intelligence, I understand that this major turn is being taken right now, and this topic of culture starts focusing and centering much more, much more on the patient that will be in the very center. And it starts at the level of different institutions. And for the health system, for our hospitals, yeah, I also would like to add that what is also very important for this system is this circuit of the care. That's what we have heard today in the sanitary and healthcare and everything. So we actually have to work on all of this flow, on all of this journey. Thank you very much to all of you. Thank you.